Greetings again. This is Dr. Bill Wyatt, and I'm a member of the American Orthodontic Society, and I want to talk to you some this morning about a problem that has faced me through the years, that people thought you couldn't put teeth where there was no bone. And the surgeons frequently, like this kid's teeth sticking up here, they would have sectioned that out and brought it back down. Of course, they have to do it all in one day. Now, we do it in a few months' time, but I want to show you 3 cases here of a young man, a young lady, and then an older man who I think was in his 80s, or I don't think he was 90 when we worked on him, but we were able to expand his teeth and move them too. So I'm going to run through this pretty quick and let's get started with the first case here. This is a young man, and there he says, after we got his teeth pulled down into place. But this is the way the teeth were. I mean, they were sticking up like this. And we brought the whole set of teeth down, you can see. We finished here. We moved the bottom teeth. And the bone goes with the teeth. If you just take a whole group of teeth, you can hardly move. If you take one tooth and hold this tooth, don't let that one move, you could move this tooth out of the bone here. But if you move the whole section, the bone structure moves with the teeth. And I think we can just put that down as something that's the way it is. Now here we took some teeth out of this young man also, and so you can see the difference in the facial structure as we go through this. Let's look at the other side of the mouth, there where we took the teeth out. You can't tell the difference. We brought this down. These teeth don't look like they stick out of the bone any more than they were here. We didn't move them out of the bone went with the teeth. And or the teeth go with the bone, I don't know which way you want to say. But if we brought that section of the face down, the teeth came right along, everything came in place, and we straightened it out like that. I'm going to have to go pretty fast. We're covering 3 cases now, and this is about the end of the case right here, and you can see this structure right here, and there's bone on the teeth. They didn't come out of the bone went with the teeth. And that, I think they had a fused tooth right here. See, it is pulled together and worked out with this with the rest of it. Let's go and look at the upper teeth after we pull these teeth back into place here, and we widen the mouth out and broad this, gave him a good smile, and fix this, and you see he's got more room for his tongue and everything, even though we extracted 2 teeth in here. So this old mess about never taking their teeth out is not necessary. Okay, here we've expanded that. On the bottom, there's the fused teeth. We just line them up, and you can't even tell. You see, these teeth are grown together right here, right there. And this is where the mouth looks. And we moved these teeth forward. There's a 6-year molar, and the whole structure of the case is changing here. Here he is when we finished, and you can see the difference in this young man's face. And now I'll show you number 2. This is a young lady that had a tremendous Class 2 Division 1 case, and I mean, it looks like we had about a whole millimeter of space out there or more, and brought her jaw forward. You see, this is Class 2 relation here, and you can see the molar is back in place here on the bottom. we move the lower jaw and we move the teeth into place in this case. Here again, the same place. A lot of this we moved the jaw forward. We brought these teeth back, and the bone went back with them all the way. So whoever comes up and tells you you can't move the teeth because there's no bone there, this is ridiculous. We do it all the time. A kid's sucking his thumb, sticking it in his mouth, pull his teeth out. I had a 45-year-old man who actually pushed a lozenge in his mouth up here and took his teeth that were fitting together and had them up like that. And the bone went with the teeth then too. And they moved here with them. And you can see how we pull this down into this place. And there the upper mark, I mean, we really expanded this case. And you see where it looks like we went way out like that and gave her a lot more airway and room back there for the teeth. Now I'm going to go, and that's the lower arch. We got a little bonded retainer on there, holding it out, and that you can see the tongue fitting in there good. Some rotation. See how this tooth is rotated? Look how it was over here, you see. So there's just a lot of things to learn about it, but I wanted to put cases up here one after the other. We've got hundreds of cases where we have expanded the teeth and the teeth moved with the bone. And here is the young lady's picture right here. And she's a real sweet girl. Now here's number 3 is a older man. I don't have a good facial starting picture of him. And his teeth were in a kind of a class 2 relation. We're going to bring this over and put this dot up here. And you'll see that this cuspid is lined up in a class 1 relation. Now, and the bicuspids and everything going back to the back. Now, this guy's in his late 70s or 80s, and we're going to move the jaw forward some and put this in a class 1 relation. And we've got the midline is not completely lined up properly, and we've got this unusually large lateral we had to deal with, and we've got him lined up like that. Now here's the difference in the guy's mouth. I didn't have a finishing shot of that, but anyway, we've got him in braces, and this is the way the teeth are, and you see how this arch went like that. These teeth are in different locations now. Age makes no difference at all. This guy, I think we could have done it if he was 90 years old when we started. We could have expanded this arch like that. And you see how much broader this is. Maybe the photography is a little in our favor there, but this is a lot of expansion in this area right here. And that's in an older person. And here the lower arch is expanded too. You see how wide this is out here, and this was spread out like that. And we move these teeth, and where there's no bone out here, the bone goes with the teeth. And if you just do it slow enough, you can hardly move the tooth out of the bone will go with it. And that's something I wanted to prove to you. I wanted this to be something, and if somebody tells you can't put the tooth there because there's no bone, don't believe them. You can put the teeth there. And this is this guy right here. And I thank you for watching, and I hope you'll join our group and subscribe to it. We're glad to have you, and I am glad to be able to do these videos for you. And I want you to subscribe to our channel. Thank you now, and I want to close out here and say goodbye.